Hi, welcome to the study of heart, and this is Dr. Jaitly. In this particular section, I'll be talking to you about briefly what are the harms from smoking. We know smoking is a physical addiction, a chemical addiction that goes on in millions and millions of people across the globe. It has almost becoming like a perpetual habit. It starts sometimes very young in age and then goes on throughout the person's life, and for decades the patient may smoke and then end up with lots of problems in health. Here in this diagram I've shown you in the far right corner the heart, what it looks like exteriorly. There is a set of arterial supply or blood supply that runs outside of the heart, and these two are called the coronaries. They are the heart's blood supply system. Remember, heart supplies the body, as we know. It's a circulating pump which is constantly sending blood every single beat of your life, and circulating in miles and miles of these arteries that are running from head to toe. These arteries like to stay open, but smoking certainly compromises over a period of time, and the narrowing begins, and that narrowing certainly compromises further on the circulatory flow, and as a result some of these vital organs can suffer. Let's start what happens to the brain. The brain arteries can undergo a similar change, and as a result the person can or has increased risk for stroke. Same thing happens in the heart. We just talked about the coronaries can get affected, and as a result somebody can suffer a heart attack, and there's a very, very high risk for heart attack if somebody smokes. Lungs obviously take a huge brunt because that's where you smoke into your lungs, and if you were to smoke into your lungs, the chances are that they will be the first organ of taking the brunt, and as a result cancer is extremely prevalent in smokers and chronic smokers. Not only cancer of the lungs, but even cancer of stomach, liver, kidney, and brain has been linked, and to colon and breast in females, and of course the head and neck cancers are also very prevalent, and they're all linked to smoking. So it makes you very, very prone for cancer. So if you don't die of heart attack or stroke, you'll die of cancer if you smoke. So these are the three biggies, unfortunately. So it's a very, very devastating course that the patient takes if he or she develops this chronic habit of smoking. It lowers the HDL, which is the good cholesterol, and as a result the narrowing is even further compromised, and the cholesterol, which is normally we have a balance of good and bad cholesterol, so if you don't have too much of good cholesterol, that means you're left with proportionately high bad cholesterol, and as a result this happens, or the narrowing happens in the arteries, and that makes the arterial system even further compromised to these vital organs. And last but not the least, it also causes peptic ulcer, besides many other insignificant conditions that I've not discussed, like pain in the legs because of the arterial problems in the legs that develops, etc., etc. But peptic ulcer is very, very prevalent in the stomach region, and these patients can later on develop cancer following peptic ulcer, etc. And peptic ulcer is a very, very prevalent condition, and it's very debilitating, also very discomforting to the patient, because at night he or she will constantly wake up in abdominal pain. Eventually they can have GI bleeding from the stomach, etc., etc., depending upon the stages of peptic ulcer. So as I said, very few things in medicine make a mathematical relationship, but this is one. So smoking certainly is injurious to health, as has been defined and stated on every single cigarette pack that you obtain at the store. So please take that very seriously, and there's a very, very, unfortunately, it's a big lasting addiction habit. Counseling works, and we'll talk about what are the other measures which we take to help in medicine to get over this habit, because this habit, the faster you quit, the better it is. In fact, some of the arterial conditions we just talked about and some of the risk factors can be reversed if you quit smoking. Although it takes a few years of staying quit, but some of the factors can be reversed. Thank you for your time, and I hope you found this interesting. Let's discuss more on my future presentations. See you then. Bye.